But there's going to be a big vote, and I'd yield time to my good friend from Michigan to let us know what's your thoughts on this.
I thank my colleague for yielding and talking about health care. You know, we can go through all of the different issues that are out there on health care. You know, what's going to be covered, what's not going to be covered. But I'll tell you, the more that I look at this and the more that I study, the more that I am coming to the conclusion this is not about the quality, it is not about the quantity of health care in America today. This is becoming more and more about who is going to control your health care, my family's health care. It's about control. Because, you know, health care is 18% of the economy, and it's going to be about whether you and I are going to be empowered to make those decisions, whether our families and others, and it's, you know, someone called me after I did the special order last night, and they said, you know, it's not you and I empowering people in the private sector. They already have the authority. They take a look at the Constitution. The Constitution gives them that authority to make these kinds of decisions for themselves. It empowers the states to have it. It is the states that have the power to do it. The only thing that may happen here in Washington is we may take that authority and that opportunity away from them and say, I'm sorry, the choice of health plans that you may have, we're going to restrict that. We're going to restrict that. You're not going to be able to choose a health savings account. You're not going to be able to choose a high deductible account. Everyone's going to have to purchase from a narrow range of options of more Cadillac type of plans that have all kinds of benefits into them, many that people don't want. So it's about control rather than quality and quantity of health care. And,
so basically what you're really saying is one of the things that's going to be lost, one of the big things that's going to be lost is the person who's sick having some say over the direction of which way they're going. I think this big blue button here, this is the nerve center. And if you want to be in the right place in healthcare, you want to be this healthcare administrator. I don't know if this is a czar or not. I'm not sure if there is a czar.
Will yield. I mean,
I do yield.
Yeah, you know, we're not only taking the authority and the opportunity to control your health care when you're sick, but it's more important. It's like for our young kids, for our kids. What we're doing is for the young person who is saying, you know, I might want a high deductible plan because I want low premiums because I've got a dream of starting a new business. And I need all the cash that I can to funnel it into that startup business because, you know what? I've got the belief and the dream that my business is going to be the next Apple computer, and I want to use all of my available resources after I've got, you know, after I bought this health insurance plan, because I do recognize that I want to be covered if I get a catastrophic illness or whatever, but I want to put that money into my business. They're not going to have that opportunity anymore.
I just reclaim my time. Gentlemen, you're talking about a situation, you're 30 years old, bulletproof, but you say, yeah, it's possible. If I got the really bad part of the statistic, I could get something I couldn't afford to pay for. So I'm going to get that catastrophic plan that fits me and my situation. I don't need OBGYN coverage because I'm a guy, and so I don't need that part of the plan. I'm just going to get this catastrophic thing and take the rest of my money, and I'm going to put it into my small business because I've got a dream.
Yeah. I think
go ahead.
I think what we're taking a look at here, because what happens is we're shifting the authority from individuals to make those kinds of decisions, and we're moving it right into that chart that's next to you and saying your health care decisions are now going to be made by the people in those charts, the people who fill those boxes. You don't know their names, you don't know their backgrounds, you don't know their values. All you know is that the health czar, I guess that blue box there,
I think this is if you push this button, it'll make the whole thing go, I think.
Yeah,
you know.
But you push that button 181 times, I think, in one of the bills here in the House. We've instructed the czar to, you shall, you will, you must. And every time that health czar has the opportunity to make that kind of a call, that's a little bit more of an erosion of the power from you and me and our constituents. The other thing is it's an erosion of power from our states. There's a lot of states that are experimenting with how to fix health care, how to address some of the concerns that are out there. And so they're experimenting, they're working, and now we're saying, sorry, it'll be one size fits all, and it'll be the size that comes out of Washington. Where in the Constitution? This right now, our colleague, you know him well, John Shadegg and I, we wrote a series of op-eds, one of which says, we have a vision for health care which is about markets and it's about personal authority. That was the first thing. The second op-ed we wrote was one that said, here's what's wrong with the Baucus plan. Actually, the Investor Business Daily that ran that op-ed, they put their own title on it. They called it Lies, Earmarks, and Corruption All in One Bill. If you read the op-ed that Congressman Shadegg and I wrote, I think the title aptly fits the content that we have in it. Then the third op-ed says, we've got a vision as to empowering individuals, or not empowering, we have a vision of leaving the power and authority with individuals. We have identified what's wrong with the Baucus plan and H.R. 3200. The third op-ed says, here are the specific things that we would do.
Gentlemen, it strikes me you're talking about freedom. Freedom.
Freedom. This is why we need the Tea Party movement, why we need the 10th Amendment groups that are out there that are fighting for state sovereignty and fighting for us to go back to the Constitution. It's why we need them to re-energize, to bring the momentum back that we saw in August, to have them fight for freedom and to stop this massacre. Because it's going to, people are now saying it's going to happen. The question is, how bad will it be? And whatever form it will be very, very bad, because it's going to be an erosion of power.
Gentlemen, I don't accept that. And I know you don't accept that we have to just roll over and just say, oh, we're going to have this government takeover of everything. I don't accept that.
We know government takeover doesn't work. It doesn't work in transportation. Michigan, in the 50 years that we've had a highway transportation bill, we've gotten 83 cents back on the dollar for 50 years. I call that legalized Washington corruption, because other states have stolen that money from us. And as one of my constituents said the other day, my friend from California must be smiling. He must be getting some of that money in California. But, the other states
happy over there.
They're stealing from us. And one of my constituents said that they had just been they went through West Virginia. And they said West Virginia has gorgeous roads, and all we've got is potholes.
Well, I think somebody's getting their fist on some of that federal. You talk about free enterprise. One aspect is, in free enterprise, you can fail. And we even allow some of our states to fail. You talked about their examples. Massachusetts and Tennessee have been pioneers in this system. And what have we learned from them? It's like Thomas Edison making light bulbs. He made 100 light bulbs. The first 100, none of them worked. Well, these light bulbs don't work either. They don't only have mercury in them. You turn them on, they just cost you money and don't work.
And this will be the first light bulb that we try, and we will impose it on all of America. As a matter of fact, we'll impose the taxes to pay for it really, really soon, and we won't be able to implement this for about 4 years. It's interesting. Of course, it won't be implemented until after the next election. Interesting.
I yield to my good friend, Congressman Hoekstra.
I just want to build on what my colleague was talking about. There's a very fundamental difference between how Republicans are approaching this problem and how Democrats are. Democrats have taken the approach that says we're going to create this massive new bureaucracy, 53 different organizations and panels and these types of things, and we are going to change health care for every single American. It is going to change. Now, when I was in the private sector, I was a marketing guy, but I spent a lot of time working with engineers. And at one of my first town hall meetings, an engineer said, Congressman, why don't you take the approach that we take in the engineering world and that you would have taken in your career in Herman Miller? Let's identify what's broken in the system, and let's fix those pieces. And that's exactly what the Congresswoman was just talking about. And on my website, we put up 7 solutions for health care that address the issue of accessibility, they address the issue of cost and tort reform. 7 specific bills that go after those 3 areas that almost everybody agrees on, that those are the things that need to be fixed in health care and can be implemented today, not in 4 years, not a massive cost, and they affect those who have issues with the current system, And for the rest of the 85% of Americans, most of whom are pretty satisfied with the health care that they've got, we leave them alone.
Yeah, gentlemen, in the state of Missouri, we have the same sort of principle. It may be not quite as much defined by engineers. We say, if it ain't broke, don't fix it.